Hi, Dr. Yass here. I want to talk about the idea of what is pain and why we experience pain, as well as how pain is transmitted, because I think that for too long, in fact, multiple decades, there has been this false premise that pain and nerves are somehow synonymous, and that if you are having pain, that means that we should look to the neurological system to identify the cause. This is a complete fallacy. It doesn't even begin to represent the true meaning of why we have pain, which is to identify a tissue in distress, nor does it open to the idea that most tissues have the capacity to elicit pain, and that nerves themselves are nothing more than pathways to allow the pain signal to be sent from the tissue to the brain to create conscious awareness that the tissue is in distress. So we need to break this mindset, because with sustaining it, people are too easily swayed to believe that positive findings on diagnostic tests, such as MRIs indicating pinched nerves or stenosis or herniated discs, that in fact, by identifying that automatically indicates that that's the tissue eliciting the symptom, and therefore that's the tissue that needs to be treated. It's a complete fallacy. If we look at what is pain, why do we have pain? Well, pain is the body's protective mechanism. It's its most immediate ability to create conscious awareness of distress of a tissue. So what's happening is some tissue breaks down, it loses its ability to perform its function, and it wants the body to recognize that so that some sort of intervention can be performed to resolve the distress of the tissue. The body elicits pain through a pain receptor, which can be found in the connective tissue that surrounds the cells of tissues. So we have the cell, right next to it is connective tissue. Within the connective tissue are pain receptors, so that if there's distress of the tissue, the pain receptor is actually triggered, which then sends a signal via a nerve. The nerve is nothing more than the pathway. It has nothing to do with the eliciting of the symptom of pain. So the pain signal is elicited by the tissue in distress, which then runs up the pathway of a nerve to the brain to create conscious awareness of the distress of the tissue. Is there any example I can provide you which you are well aware of, which really exemplifies this idea? Well, the answer would be yes. Let's say that you're having a heart attack. If something's wrong with the heart, if there's distress of the heart tissue, the body is going to elicit pain at the left chest region and left arm. That particular signal, that indication of pain at the chest and the left arm, is a very specific symptom indicative of distress of the heart. You got the symptom because the heart was having difficulty, and the body wanted you to recognize that there's distress of the heart so that you could create an intervention to resolve the distress. Now, once the heart is resolved, you would see that the symptom of pain at the chest and the left arm would simply cease. There's no reason for it to exist anymore because its job has been taken care of. You got awareness of the distress of the heart, you took care of the distress, and now there's no reason to continue that distress signal. That's what you need to understand pain to be. It is a distress signal indicating that a tissue is not functioning properly, and it's trying to make you aware of that. So if we really look at the concept, we can talk about multiple tissues. If you're having kidney stones, certainly, right, you get back pain. That's an indication that the kidney has the capacity to elicit a symptom. It is not the nerve. There's no nerve running through the kidney that's causing there to be pain. It's actually mechanical, an inability of a cholesterol molecule to run through a tube in the kidney. So it's the kidney itself that's eliciting the symptom. You have gallstones, you have a heart attack, you have a cut on your skin. You have a multiple different tissues have the capacity to elicit pain. And it does so through the pain receptors in the connective tissue surrounding the cells of the tissue. So we need to stop believing that pain is synonymous with nerves, and therefore the identification of structural variations in the neurological system somehow justifies that, automatically means that that's what's causing the symptom. It's a complete fallacy. It's just absolutely false. Every bit of evidence indicates that. Now, in terms of why most people have pain outside of systemic situations like kidney stones or gallstones or heart attacks. When we're talking about the neck, the back, and the extremities, what we're really looking at is muscle. And muscle is breaking down due to its inability to perform the functional activities you're trying to perform on a daily basis. So the muscle strains, and in straining, it's in distress. Being in distress, it elicits a pain signal from the pain receptor that's in the connective tissue that surrounds the muscle cells. And as a result, it's trying to create awareness that there's distress of this tissue. The fact that the distress and the pain that is experienced is associated with dysfunction and inability to perform functional tasks, that in fact it is when you're trying to perform the task that brings on the symptom, should be an absolute indication that it is muscle that's eliciting the tissue versus this ridiculous premise that it's from your spine or some structural variation of the nervous system. We have to accept the idea that it has nothing to do with the nervous system simply because nerves are the pathway that are taking the distress signals from the tissue and bringing them to the brain. That's outrageous to believe that. They're simply a pathway. It has nothing to do with the distress of the actual releasing of the distress signal. It's the tissue in distress that's doing it. And in this particular case, and in the vast majority of cases, 95 to 98%, it's muscle. What you have not been taught is the idea that muscle itself can elicit pain. It elicits pain through the pain receptors found in the connective tissue that surrounds the muscle. Then it is transferred via a nerve, not the nerve eliciting the symptom, but the pain signal from the pain receptor in the connective tissue surrounding the muscle is what is eliciting the symptom and transferring it up to the brain so that you have awareness that you have this muscular deficit. Now, the body presents a multitude of other signals to indicate this beyond looking at the pain itself. If it is muscle, we could look at altered functional capacity. Let's say you're limping. Let's say you can't sit for a sustained period of time. Let's say you can't walk for a sustained period of time. Let's say you can't kneel. Those are all indicative of a muscular deficit and that the pain is a representation of distress of muscle. We could look at altered posture. We could look at someone who's hip flexed forward, who's side bent to one side. Any of these going along with the situation that you're having pain elicited are all indications that muscle is the tissue that's eliciting the pain signal. So we want to take a look at the whole body and what it's presenting in terms of its symptoms beyond just the signal of pain. When you start to put this all together, you start to realize the reason that the back surgery failed, the reason that the epidural nerve block failed, the reason that the cortisone shot failed, the reason that all the other treatments have failed is because you're not treating the tissue that's actually eliciting the distress signal. And clearly, without treating the distress of the tissue, by nature, the distress signal simply continues to be elicited. That in itself should be the wake-up call for you who has had treatment over multiple months or years that you're still having your pain. Tells you that the wrong tissue has been addressed. The tissue in distress has not been the tissue that has been treated. If it was, the distress would be resolved. There'd no longer be the need for the distress signal of pain to be elicited, and it would stop. If we represent that through the Yass method, it is clear that in the treatments that are provided, when the cause or the actual, when we talk about cause, what we're really talking about, tissue that's eliciting the symptom, the tissue in distress, when I address muscle, and the Yass method addresses muscle, and that is the tissue eliciting the symptom, within a couple of treatments, a couple of bouts of exercise that the person performs, the symptom begins to diminish at a rapid rate. If it is muscle, within a couple of weeks to 1 or 2 months at most, you should see a major reduction in symptom, if not a complete resolution. And that is because the distress of the tissue, which happens to be muscle, which is having difficulty performing functional tasks because it is strained, has been overcome with targeted strength training, thereby allowing the tissue to perform properly, resolving its distress, thereby no longer needing the pain signal to be elicited. And that's it. Your symptom is resolved and you return to full functional capacity. So please understand that pain is an indication of a tissue in distress. The goal of diagnostics is to identify what tissue is in distress, resolve the distress of the tissue. If it's muscle, that means targeted strength training. That's what the Yass method does. It is based on the principles that the symptoms being presented, along with just the pain signal, other indicators that the body is trying to provide to let you know what tissue is eliciting the symptom. So it is an interpretation of the body's presentation of symptoms. It ignores diagnostic test findings because it's completely invalid. And then, if it is muscular in nature, allows for targeted strength training to be performed to resolve the distress of the tissue so the pain signal no longer has to be elicited, thereby ending the pain and allowing you to return to full functional capacity. It is the only system designed to identify all potential tissues, which in a sense means all potential causes of symptom, and if muscular, has the only true mechanism to properly utilize targeted strength training to resolve the distress of muscle. If you want more information about this system, if you're seeking a way to resolve your pain because the existing model has failed and it's been months or years and you're still struggling with a symptom of pain or other form of symptom, you must recognize that indicates the wrong tissue has been has been treated, and it has not properly identified the tissue in distress. The Yass method does that. If you want more information about the Yass method, you could go to www.mitchellyass.com, MITCHELLYASS.com. If you have questions about your situation, you want further understanding, you'd like to talk to me directly, you can contact me at Dr. Mitch at mitchellyass.com, DRMITCH at MITCHELLYASS.com, or just call me on my cell, 516-449-1359. The goal is to get you the information. For whatever the reason, I've been given this understanding as to how to properly diagnose with an understanding of how to identify what tissue is eliciting the symptom. If it is muscular, I've also been given the opportunity to understand how to strengthen appropriately to allow muscles to work properly, allow for full function with full resolution of symptoms. You need to get the information because without it, you will still flounder. The existing system fails, continues to fail, and who's suffering? It is the patient. It is the person who can't get the answers to allow them to get beyond their symptoms and get the life back that they so truly deserve. So please contact me. This is Dr. Mitchell Yass wishing you a pain-free, fully functional life. Bye-bye.